First off, I just want to thank you, Michael, for taking the time to join us today. It's a real pleasure to talk to you, and I'm sure that everyone who reads our work at Heartland is familiar with you and all of the work that you've done over the past years on the healthcare front and on economics and everything else at Cato. So thank you for all that great work, and thank you for taking the time to talk to us.
Well, you're welcome, and thank you.
I have a couple of questions about where everything goes with healthcare in Washington now that everything has panned out in Massachusetts the way that it has. And I just wanted to lead in by saying that clearly there's a number of people out there saying that healthcare is dead and that the issue is basically off the table now for Obama and for the Democratic leadership in the House and Senate. Is that what you think, and why or why not?
Well, I think that's wrong. I think that the Obama plan, or really the left designs on healthcare to nationalize our healthcare sector, it's a little like Lord Voldemort. Every time you think you've killed it, you find out he's not quite dead. So for 100 years we've been trying to kill this idea of socialized medicine, but it keeps rearing its ugly head. And even though Scott Brown's victory in the Massachusetts Senate race to fill the term of the late Senator Ted Kennedy has dealt the Democrats a body blow, I don't think that means that there will be no health care legislation this year. It makes it harder, and it was already hard, so it's not looking very good. But I don't think that we can that we can let our guard down. I think we have to keep being vigilant, keep trying to educate the public about how harmful this legislation would be, how it would increase taxes, how it would result in government rationing of care, how it would not improve the quality of care at all, and cause health spending and health premiums to rise.
Well, it seems like there are a couple different options for how the Democrats proceed, and obviously they're hashing these out as we speak. Which do you think is the likeliest to actually pan out and be the way that they actually approach the issue?
Well, let's look at a number of options. We'll see if we can take them if we can address them in anything that seems like a logical sequence. The first option that everyone discussed, or that a lot of people feared the Democrats would exercise if Scott Brown won, would be to ram something through Congress before Scott Brown could be sworn in. Have the House and Senate hash out with the president one bill that can pass through both chambers, and use Senator Kirk's vote. This is the fellow who was appointed to fill part of Senator Kennedy's term until the special election to be held. Have his vote be the 60th vote that they need in the Senate, and get it done quickly. That would be a pretty sneaky thing to do. It would probably be legal, but there'd be a big political backlash, and President Obama has ruled that out. The next option that people have talked about is to have the House pass the Senate bill and send that directly, which would send that bill directly to the president. That's not going to work. A lot of House Democrats are very uncomfortable with the Senate bill. Basically, their discomfort shows that Democrats like the idea of massive government subsidies for health insurance. They just don't want to pay for it. So the House Democrats don't like the tax on union plans because that taxes their constituency. They don't like the Medicare rationing board that the Senate created because that would reduce the amount of federal dollars that flows to doctors and hospitals in their districts, and on down the line. So the House Democrats aren't going to pass the Senate bill. There's been some talk about having the House Democrats pass the Senate bill and at the same time pass what they call a reconciliation measure that would quote fix all the problems that they have with the Senate bill. But the problem with that is there are a lot of problems with the Senate bill that a reconciliation measure could not correct, such as the pro-lifers' dissatisfaction with the Senate's abortion language. The Senate bill would force taxpayers to subsidize abortions, and I don't think that's something that the reconciliation process can address. And then there's no guarantee that that same reconciliation measure will make it to the Senate, and the Senate may insist on its own provisions rather than the ones that the House wants in the reconciliation measure. So I don't think that is a viable option either. There has been some discussion of Democrats trying to woo over moderate Republicans like Olympia Snowe or Susan Collins from Maine. I don't think they're going to have much success there. For one thing, Collins and Snow are pretty disgusted with the process. They've been insulted, I think, by Senator Harry-Reid, the majority leader, and
could he have timed that? Could he have timed that whole "it was a waste of time to talk to them" statement any worse than he actually did? I mean, that just was the worst
it's as though Martha Coakley was whispering in his ear. But here's why I don't think they're going to have any success with the senators from Maine. If you'll recall, I think it was on Christmas Eve, the Senate voted on a constitutional point of order that Senator John Ensign from Nevada raised, that said that the individual mandate in the Senate bill was unconstitutional. That it violated both Article 1, Section 8 of the Constitution as well as the Fifth Amendment. Both Collins and Snow voted aye on that amendment. They registered their judgment that the individual mandate violates the Constitution because Congress doesn't have the power to force Americans to purchase a private product.
Sure.
So for the Democrats to reach out to them and try to get them to accede to a bill, to be that 60th vote that they need in the Senate, they're going to have to either jettison the individual. They're going to have to jettison the individual mandate, basically, and Democrats won't do that. And they're going to have, but they would have to, because Snow and Collins can't really vote for an individual mandate at this point. If they do, if they vote for an individual mandate after voting to declare an individual mandate constitutional, they could reasonably be accused of violating the oath they swore to the Constitution when they became senators, when they joined the Senate. So I don't think that reaching out to moderate Republicans is going to be much of an option for Democrats, which leaves two options.
Okay.
The one that they're talking about right now is paring it back to its most popular elements and trying to pass those. The legislation's most popular element is the law that would prohibit, or the provisions that would prohibit insurance companies from discriminating against people on the basis of pre-existing conditions. So that an insurance company cannot deny you coverage. They cannot exclude your pre-existing condition from coverage. They can't charge you higher premiums if you have a pre-existing condition. The problem, that's a very popular provision. It also happens to be a price control, and as President Obama's economic advisor Larry Summers instructs us, price controls always cause economic damage, and that damage gets greater over time. But the problem with this particular price control is if they impose that by itself, the entire insurance market will collapse. And the reason is that that price control increases the prices for healthy people in order to subsidize and reduce the premiums for sick people. But when you do that, when you jack up the premiums for healthy people and at the same time tell them, hey, when you enroll with an insurance company, they can't charge you premiums higher than anyone else. Well, the healthy people say, forget it. My premiums just went up, and I can drop coverage and only buy it when I need it. They're going to drop out of the market. When the healthy people drop out, the premiums for everyone else rises, so more people drop out of the market because they know that they can buy coverage whenever they need it at standard rates, and the market collapses. That's not sustainable. So if they're going to do that very popular provision, well, then they have to include an individual mandate to force the healthy people to stay in the market and buy coverage. And if they're going to do an individual mandate, they have to have subsidies to help low-income people comply with that mandate, and pretty soon they're right back where they were. They have a very expensive, very intrusive bill. They have to figure out how to pay for it, and as we already said, Democrats don't want to pay for their own legislation. So that's not it seems to me that that's the option that they're going to go with, but it doesn't seem like a very viable one. It's something that is easily attacked. Finally, they can start over from scratch and try to get some health care provisions done in the reconciliation process. Their hands are really very tied if they try to do that. Yes, the reconciliation process lowers the bar in the Senate that they have to clear from 60 votes to 50 votes. Because if it's a tie, they get Vice President Joe Biden to vote their way. They're done. But
I don't know. You can never really trust what Joe's going to do. So
well, I think you can never trust what he's going to say, but his votes are generally predictable.